Hi everyone, my name is Disha and I'm the founder at womens-health.ai, an expert-backed nonprofit working to bridge the cancer care gap in society. We offer a variety of free tools to help women at any stage of their breast cancer journey. Today, the goal of this informational camp is really to empower you with information about breast cancer so that you can then use that knowledge to uplift and empower your entire community. Fighting cancer really starts with understanding cancer, and that's what we want to achieve today. Now, maybe you've heard the word cancer before, or maybe this is new for you. Either way, this talk is for you, because when we understand how our bodies work, we can protect them. We can protect ourselves, our sisters, our mothers, even our neighbors. So, what is breast cancer? To understand that, we need to talk a bit about the breast. The breast is the part of the body that sits on the chest. In women, it's where breast milk comes from when feeding a baby. Inside each breast, there's a mix of fat, small tubes like tiny straws, glands, which make milk, and blood vessels. These parts all work together, just like any organ in your body. Now, sometimes the cells in the breast start growing in the wrong way. Every part of your body is made of millions of cells. Usually they grow and die in a natural order. But with cancer, a few cells start growing too fast and don't stop. They might stick together and form a lump. This is called a tumor. Sometimes the lump even stays in one place, but other times the bad cells spread to nearby areas or other parts of the body. That's why breast cancer can be so dangerous, but it can also be treated, especially if it's found early. On this slide, you see some statistics. 1 in 8 women will develop breast cancer in her lifetime. Imagine if your house caught on fire. Would you want to find out when there's just a little smoke or when the whole house is already burning? That's what it's like with cancer. If you notice the signs early, there's a much better chance of healing. Doctors can act quickly and the treatments can be simpler. Most importantly, you can live a full life. Now, mortality rates in the US stand at 7%, compared to 27% in India and 60% in Africa. And the staggering disconnect really boils down to the time of diagnosis. If cancer is detected earlier, it leads to better outcomes.
Hello, everybody. Greetings from my side. I'm Dr. Mandeep Malhotra. First of all, I want to congratulate you all for this wonderful initiative on creating breast cancer awareness. Breast cancer, amongst all the women's cancer, is one of the most common cancers, but it is one of the most treatable cancers. And if we are able to detect the cancer at an early stage, then the chances that we'll be able to make a patient cancer free is as high as 90%, which is like at par with any other disease. Even breast cancer treatment becomes more simpler than treating diabetes or even heart disease. The important fact is that if breast cancer is detected at an early stage, majority of patients will not lose their breast, and a large majority of patients would, like, we can just do a surgery in which we can remove the affected part, we can reconstruct the whole breast. Secondly, we can just put the patient on hormone tablets so that the cancer doesn't come back. Even the aggressive variety, that is triple negative or HER2 positive, can be very well treated with simple chemotherapies, even targeted therapies which don't have much side effects. And also, the treatment is very good. And I reassure you again that the woman will not have to lose the breast. Another important fact is that a 20 to 30% variety is hereditary. Hereditary means it runs in the families. You can actually check our website, go through the performer, and understand your family risk and take the necessary precautions as suggested by Disha. Thank you, take care, and a very best of luck from my side.
If breast cancer is found at the very beginning, and the beginning is what doctors refer to as stage 0 or 1, almost 98 out of 100 women survive at least 5 years and maybe live much longer. That's almost everyone. But if you wait, if the cancer is found later at stage 2 or stage 3, when it's grown bigger and spread to other parts of the breast, then the chances of surviving drop to around 72 to 93 out of those 100 women. And if the cancer is able to spread to the bones, liver, or brain, that is stage 4 or metastatic cancer, their survival drops to just 32 out of 100 women. That means that the majority of women in this stage will not live more than 5 years. So you can see that the difference between life and death is often timing. But here's the good news. When it's caught early, the treatment is much easier. For example, a woman might be able to actually keep her breast, and the doctor will remove the lump instead of taking off the whole breast. She might not need strong chemotherapy, which can make people very sick, and she might not need to travel far or stay in hospitals for as long. So that means that there's less cost, less fear, and more peace of mind. So that is why we teach girls and women to check their breasts every month. We're going to show you how in this next clip. Okay, let me show you something simple and powerful. It's called a self-breast exam. This means that you check your own breasts to make sure everything feels normal. You should do this on the first of every month. And here's how you do it. You look in the mirror, you take off your shirt and stand in front of the mirror. Put your arms at your sides and look at your breasts. Do they look the same? Is one bigger? Is there any redness, swelling, or dimples? Now, raise your arms above your head and look again. Then place your hands on your hips and lean forward a bit. Now you're going to lie on your back and use the pads of your 3 fingers, not the fingertips, and press gently in a circle around the entire breast, like drawing rings from the outside to the center. Check from the top near your collarbone, down the side under your arm where the lymph nodes are, all the way around your nipple. Use different pressure, light, medium, deep, and make sure that you know you're feeling for anything that's hard, strange, or new. Now, if you do feel something unusual, don't panic. Most lumps are not cancer and they can be from hormones or other things, but go to a nurse, a health center, or a doctor so they can check it out. Knowing your body is the first step to protecting it. Now, let's talk about one of the most powerful tools we have in the fight against cancer: prevention through healthy lifestyle and nutrition choices. Did you know that up to 30 to 50% of all cancers are preventable? That means nearly half of all cancer cases can be avoided by making healthy choices every day. And when it comes to breast cancer, these changes can make a real difference. Let's start with nutrition. A plant-based diet is one of the best things you can do for your body. That doesn't mean you have to become vegetarian, but it does mean eating things like leafy greens, vegetables like broccoli, cabbage, and cauliflower, and colorful fruits like berries. These foods are full of antioxidants and nutrients that help your body fight off abnormal cells before they turn into cancer. Now, fiber is also important. Foods like whole grains, beans, lentils, fruits, and vegetables are rich in fiber. A high fiber diet helps your body remove excess estrogen, which is a hormone linked to breast cancer. Now, let's talk about exercise. Aim for at least 150 minutes a week of moderate physical activity. That's just about 30 minutes a day, 5 days a week. Activities like brisk walking, dancing, cycling, or even doing chores like sweeping or farming all count. Regular exercise helps balance your hormones, boosts your immune system, and reduces inflammation. These are 3 things that help protect you from cancer. Now, maintaining a healthy weight is also key. And alcohol is another important factor. Even 1 drink a day, like a glass of wine or beer, can increase your breast cancer risk by 7 to 10%. And finally, don't smoke. Tobacco is linked to many cancers, including breast cancer. There's no safe amount of smoking. Now, making these changes doesn't guarantee that you will never get cancer, but they do greatly reduce your risk and improve your overall health. Prevention is powerful, and every small step counts. Let's play a quick game, myth or fact. Over here, I have 4 things listed out. Read them and decide in your head whether you think it's a myth or a fact. I'll give you a few seconds. All right, it turns out all of these are myths. Let's start tackling them one by one. The first one is that only old women get breast cancer. As I mentioned, while older women are more likely to get it, younger women, even teenagers, can get it too in rare instances, and the time to start preventing cancer is never too soon. The second myth: if I find a lump, I will definitely die. That is not true. Many lumps are actually not cancer, and even if it is, again, early treatment can really make a big difference in improving your outcome. But especially at a younger age, if you do see a lump, there are many chances that it could be a benign cyst or something else. So it's best to just go to a healthcare provider. Now, the next myth that breast cancer is a punishment or a curse. That is just not true. It is not spiritual. It is a medical issue. And so it's really important to treat it like one. Now, the final myth is that men cannot get breast cancer. And that is, again, false. Getting breast cancer as a male is rare, but it's true because men also have breast tissue. And that means that they can get cancer too. Now, let's talk about a powerful tool that helps doctors find breast cancer before you can even feel a lump. It's called a mammogram. A mammogram is an x ray of the breast. It takes a picture that lets the doctor see inside the breast tissue. With it, they can spot changes like lumps or calcium deposits that are too small to feel with your hands. It's especially helpful for finding tumors early when they're very small. In fact, a mammogram can detect tumors as small as zero point 0.2 to zero point 0.3 centimeters. That's smaller than a grain of rice. Now, for women who are at average risk, meaning they don't have a family history or other factors, mammograms are recommended starting age 40. After that, it's a good idea to get one every 1 to 2 years up until around the age of 74. Now, a large study published in The Lancet in 2020 found that mammograms reduce breast cancer deaths by 41% in women aged 50 to 69. That means almost half as women die when they are screened regularly. And what about safety? A mammogram uses a very low dose of radiation, and that's just about the same as the natural radiation we're exposed to from the earth over 7 weeks. It's quick, it's safe, and it's highly effective. So if your mother, grandmother, aunt, or teacher is 40 years or older, encourage her to ask a doctor about getting a mammogram. It might be a short visit, but it could add years to her lifetime. Now, another option. A breast ultrasound uses sound waves to create pictures of the inside of the breast. It's a bit like how bats or submarines use echoes to see their surroundings. This technology helps doctors look more closely at areas where there may be a lump or a change in the tissue. Ultrasound is often used when mammogram shows something unusual or when a doctor feels something during a physical exam. It gives a clearer view, especially for women with dense breast tissue, which is more common for younger women under the age of 40. Now, one of the most helpful things about ultrasound is that it can tell the difference between a solid tumor and a fluid-filled cyst. That's important because many cysts are harmless, and knowing the difference really helps doctors decide what to do next. Ultrasound is also safe and non-invasive. That means nothing goes inside your body and there's zero radiation. In many parts of the world, including rural areas and places without access to mammography, ultrasound is a key tool for breast cancer detection. So even if your mammogram isn't available, ultrasounds can still help catch problems early and save lives. Now let's talk about the gold standard for detecting breast cancer, a breast MRI. A breast MRI, or magnetic resonance image, uses radio waves and magnets to create a very detailed picture of the inside of the breast. It doesn't use x-rays or radiation, and the images it produces are often much clearer than other types of scans. Now, MRI is not used for regular screening in the general population, but it is strongly recommended for women who are at higher risk. This includes women who might have a BRCA1 or a BRCA2 gene mutation, women with a strong family history of breast cancer, women who have had radiation to the chest, or women with very dense breast tissue. Now, MRI is more sensitive than a mammogram, which means that it can pick up cancers that other tests might miss. However, it's extremely expensive, and not all hospitals and clinics have the equipment. That's why it's not generally used for screening unless someone is known to be at higher risk. If someone is diagnosed with breast cancer, they are not alone. There is help. Here are the most common treatments. The first one is surgery. A doctor removes the cancer lump. Sometimes the whole breast might be removed to actually stop the cancer from spreading, and this is called a mastectomy. Now, the next treatment option is chemotherapy. This is a strong medicine that kills cancer cells, and it's given by way of injection or pills, usually in a hospital. However, the struggle with chemotherapy is that even though it kills cancer cells, it can also kill some healthy cells, which leads to a lot of side effects in the body. Now, next is radiation therapy. This is a machine that uses light beams to target and destroy cancer cells inside the body. And finally, hormone therapy. For some cancers, medicines are used to block hormones that help the cancer grow. A lot of times, people don't just get one of these options, they get a combination treatment. It really depends on how big the cancer is and whether it has spread. The earlier the found, the simpler the treatment, and that is why self exams matter so much. Now, let's hear from an expert about what comes after treatment.
Hi, I'm Laurie Pepin, an oncology physical therapist. That means I help people recover physically after cancer, especially breast cancer. Most people think that once chemotherapy or surgery is over, the hard part is done. But that's not always true. A lot of women struggle with things like swelling in their arms or chest that doesn't go away. That's called lymphedema, and it can happen when the body's lymph system gets blocked or slowed down after treatment. That's why I teach something called lymphatic self massage. Gentle movements women can do to help themselves on their own, drain the fluid, and feel better. It's not painful or complicated. It's just about understanding how the body heals. Why am I telling you this? Because being informed, even at your age, makes you more aware of what your mom or your aunt or maybe even your teacher could be going through. You'll know how to support them, how to encourage checkups, and how to understand that healing doesn't stop right after the hospital. Thanks for learning about this today. Staying informed is the first step towards protecting your own health and supporting the others in your family.
Let's take a minute to understand the risk factors for breast cancer, the things that can increase a person's chance of getting it. Some risk factors are not in our control, but it's still important to know about them. Unchangeable risks include your age, because breast cancer is more common in women over the age of 50. Another is genetic mutations. About 10% of breast cancers are linked to inherited gene mutations, especially in the BRCA1 and BRCA2 genes. Next, family or personal history. If your mother, sister, or grandmother had breast or ovarian cancer, your risk may be higher. If you've had cancer before, you're also more likely to get it again. Next, early menstruation before age 12 or late menopause after age 55 increases your risk because you have a longer exposure to estrogen. And finally, any previous radiation exposure to the chest, especially at a young age, can increase your risk later in life. Now, let's talk about the risks that we can control. These are related to our lifestyle. Lifestyle related risks include obesity. Being overweight, especially after menopause, increases the risk of breast cancer. Alcohol use, like we talked about, smoking, a lack of physical activity, and having long term hormone therapy can increase your chances of developing breast cancer. All right, we've learned so much today. Breast cancer is real, but it is also something we can fight. We can fight it with knowledge, by checking our bodies, by eating well, and by telling people around us in our community, our sisters, our mothers, our teachers, our friends. Now, I'd like you to take a lifetime risk assessment today at womens-health.ai/BRCA. There is something called a Tyrer-Cuzick exam on this website, and it will allow you to determine your lifetime risk of developing breast cancer based on the size of your breasts and your family history. This is a really important first step in making sure that you're aware of what your personal risk is and how you can work to mitigate it in the future. Similarly, we offer a nutrition program which actually helps you mitigate this risk and figure out what lifestyle changes you can do to prevent cancer from occurring. For women who have recently been diagnosed with breast cancer, we have a support forum which features advice from previous breast cancer survivors and cancer coaches. And finally, if there's anyone in your community who is recovering from any form of breast cancer treatment, we offer a complete rehab program. Thank you so much for being here with me today and bearing through this presentation. My last piece of advice is that your health is your power. And again, thank you so much for joining today.